Hey everyone, Dr. Taylor here with Tennessee Center of Integrated Medicine. I'm excited to talk to you today about leaky gut. So we're going to kick off this email series talking about what leaky gut really is, and we're going to look at a schematic that I made to look at a healthy GI system versus a leaky gut GI system. So what we're going to do is we're going to start up top here and show you what normal really is. So throughout the GI system, we produce a lot of acid in the stomach and digestive enzymes to help break down food. Also, these cells within the GI system are right next to each other, so there's no gaps in between here. So it creates a nice barrier, nice wall between what's called the gut-associated lymphatic tissue and the blood vessels right next to the GI system. So there's a wall here between the blood and what's in the digestive system. So this is very important. So when we eat protein, carbs, fats, those nutrients get broken down by enzymes released by the cells within the stomach and the small and large intestine. And those nutrients, they pass through the cells of the digestive system. So it's normal for them to go through the digestive system, and then it enters into the blood system to actually nourish the body. Toxins, when we eat toxins, it happens, you maybe have a little bit of a mold, or you inhale a toxin, or whatever it may be. Those toxins stay within the GI system and they don't absorb into the bloodstream. So the cells, that nice wall, that semi-permeable membrane, blocks those toxins from getting into the bloodstream. So those just keep on passing through without affecting anything. So we have what's called the gut-associated lymphatic tissue on either side of the GI system, and this is just our primary immune defense against potential threats or invaders to the body. So when you hear people talking that we have 70-80% of our immune system within the GI system, that's what we're talking about. We're talking about the gut-associated lymphatic tissue. So that's normal, that's what should happen. Now let's go down to abnormal, or what we're talking about with leaky gut. So what happens with leaky gut, we just get a lot of inflammation. So this could be from food sensitivities, it could be things that we're exposed to in the environment that's getting into the GI system and is causing a lot of inflammation. So when that inflammation gets triggered, what we release is called zonulin. So you see zonulin here, and that will actually increase the gap junctions. So it will increase the space in between each of these cells. And what that does is that allows this gut-associated lymphatic tissue to get involved. So the immune system is actually going to attack whatever gets released into there to help get rid of it. And on a short-term scale, that's okay, that's what we want. But if this happens long-term without any rest, then that's when we get into a lot of symptoms, a lot of systemic type symptoms. So what happens is we get nutrients, we get carbs, protein, fats. So say we have a food sensitivity, we shouldn't be eating wheat or dairy or eggs. The body can't break that down, and basically it activates zonulin to get this lymphatic tissue involved. So these nutrients may not get fully broken down, and some nutrients may actually pass through here and actually get into the bloodstream, but we may get kind of large chunk or not completely digested nutrients that pass in between the cells, and it goes into this lymphatic tissue. So then this lymphatic tissue will attack undigested nutrients, and it creates inflammation, creates a lot of discomfort, and that will go into the bloodstream and just cause a whole lot of symptoms elsewhere in the body. Same thing with toxins. If we have increased zonulin within the body, within the GI system, toxins then are able to go in between the cells and get into this lymphatic tissue, and then the gut associated lymphatic tissue is going to see that and say, no, you shouldn't be in here, you're a foreign invader, so let's get rid of you. So the gut associated lymphatic tissue is actually going to attack the toxins, just like it possibly was a food sensitivity. It's going to increase inflammation, and all that's going to drive into the bloodstream and cause inflammation elsewhere. So that's where you can get like joint pain, skin issues, anxiety, brain fog, gut discomfort, all those vague symptoms, and all of it could be related to gut because of all this inflammation going on here. I hope this overview of normal versus abnormal makes sense and kind of paints a picture going forward as we go through this email series. Thanks for watching, and we'll see you next time.